So I think it's important to know that when we're talking about insertion torque, we're talking about how much energy is required to rotationally crank that screw down like a carpenter to fully being seated in the native bone. And this is a one-time measurement. We cannot repeat this if we're ethical, and it's rather invasive sometimes to perform a reverse torque test. Now, when we talk about RFA, or resonance frequency, we're really measuring the stiffness of the implant body, the stiffness of that connection physically between the implant and the bony housing, and the stiffness of the bone. And what is the ratio of cortical bone in contact with an implant and the cancellous bone along the primarily majority of that implant body? It measures axial stability, which is totally different than rotational stability. These are two different parameters, but this is non-invasive, and we can repeat this, so we can follow an implant along its healing course.